High incidence of malignant pleural mesothelioma in Australia. Australia has the highest per capita rate of mesothelioma cases. The worst, experts say, is yet to come. Most of the mesothelioma cases in Australia are of the malignant pleural mesothelioma type. Most of the detected cases have contracted the disease due to exposure to asbestos. When the asbestos fibers or asbestos dust is inhaled through the nose, it travels down the respiratory system. Then it settles down in the lungs. The lungs have a lining called as the mesothelium lining. When this lining comes in touch with the asbestos fibers, it starts behaving in a funny manner. It starts dividing rapidly and it also starts having longer lifespans. This causes tumors in the lungs and this condition is called pleural mesothelioma. This may be cancerous malignant pleural mesothelioma or non-cancerous benign pleural mesothelioma. Australia has a very high number of malignant pleural mesothelioma cases. This is a very terrible condition and has no known cure. Since the symptoms of this disease like fever, cough, chest pain, etc. are often confused with other diseases like pneumonia, it is quite difficult to correctly diagnose this disease. Mostly it is diagnosed only in the last stages of the cancer. The patient lives for hardly a year after the diagnosis. Also, the latency period of this disease is very long. Latency period is the period between exposure to asbestos fibers and the onset of this disease. Because of the long latency period of nearly 20 to 30 years, many times this disease is not spoken as connected to asbestos. Australia has about 16 cases per million populations of adults affected with mesothelioma every year. Also, the number of mesothelioma cases in men is much higher than women. Around 600 cases of mesothelioma are recorded every year in Australia. It is expected that in the next 10 to 15 years, some 13,000 more mesothelioma cases will be recorded. There is a high-risk group in Australia. The following people of Australia seem to be getting mesothelioma more as compared to the remaining population: O-town residents, O-builders and building labourers, O-workers of shipbuilding and dockyard, O-railway workers, O-asbestos factory workers, O-power station employees. Though Australia has such a huge incidence of mesothelioma deaths, Australia is the world's pioneer in undertaking a lot of medical research in mesothelioma. It has found a new method of treatment that promises to reduce the mortality rate. Since there is no cure for this disease, it is better if it detected earlier. The normal methods of treatment like chemotherapy and surgery do not work in the last stages of cancer, so it is better if the disease is detected as early as possible. The Australian researchers have invented a new screening test that can help detect mesothelioma of the malignant pleural type. This can be used in the high-risk group to find out early evidences of the malignant pleural mesothelioma. The earlier the disease is detected, the more better the chances of survival of the patient. The Australian researchers are undertaking more and more research in the medical field of mesothelioma. Australia is a real pioneer in mesothelioma research. It is a leader and example for all the other countries. Though Australia has done so much to advance mesothelioma research, still the future of Australia is bleak. It is expected that the number of mesothelioma deaths in Australia will continue to skyrocket till the year 2020. After this, it is expected that the mesothelioma deaths will steadily decline before finally stopping. This is mainly because of the long latency period of mesothelioma. So, even after all types of asbestos are completely banned, the effects of asbestos exposure can be felt till some 20 to 30 years later. The one advantage of all the research is that the chances of survival have increased for mesothelioma patients. Also, the lifespan of the patient after the detection of the disease has increased. Previously, the patient had hardly a year left to live. However, now, due to early diagnosis, this has substantially increased. Australia should continue to undertake more research on mesothelioma for the global good. It should try to advance medical science to make new innovations in the treatment of mesothelioma. All the other countries should actively support and help Australian efforts. Australia should also make available the fruits of its efforts for the entire wide world. http://www.mesotheliomaattorneyfreeconsultation.com. Francisco Rodriguez. About the author: do you need a mesothelioma lawyer?